streets.
Are you tired of trends?
I am sick and tired.
Hi everybody, Dr. Anjana Bhana here, and I'm going to be talking about trends in aesthetics. So, I really actually don't like saying trends in aesthetics. I remember, I don't know, it was some fashion icon guy, I can't remember who it was, but he was talking about being trendy and being stylish, and we shouldn't actually, as practitioners, always hop onto trends, but sometimes, you know what, everyone is almost forced to, because of social media. There'll be like a upsurgence of interest in things we've been doing for ages, you know, the radio frequency, or now the Nefertiti lift using biomodulators, polynucleotides that's been used, you know, for wound healing for over 20 years are now, you know, the salmon sperm facial, so things are, you know, it's almost like a cycle. You know, the way leopard print comes in and out of fashion, and it's the same, unfortunately, with aesthetics. But I think the important thing is, and it's a take-home message, is that it should always be individualized and personalized. And you know, that's one of the things I might have a concern with, is a discussion with trends. So we have lots of big meetings every year in terms of company launches, trainings, things like that. There were two very big events, as we call them, this year. One focused on the biostimulator in combination with, actually both of them, they were almost the same, by the particular company's biostimulator with HA fillers as well, and the trends, there were 10 top trends. There were so many, I can't remember. There was like fast beauty, fast aesthetics, slow beauty, slow aesthetics, green beauty. So those sort of trends, like people want to be more sustainable, gender fluidity as a trend, like, you know, no more masculine, feminine, more softer or harder looks. And then again, it keeps on coming up, diversity in aesthetics, and I don't know if it's a trend, is it really taken seriously? And then this big thing, the big theme in both events was individualized beauty, being an original, being you know, like being true to the person's individualized and personalized beauty. And I think, like, why does, I know this is going to sound like, the way I'm going to say it sounds strange, but why is the focus that now? And shouldn't that have been the focus forever? So since we started, and maybe because we're not that typical, you know, cookie cutter beauty in terms of like aesthetics. When I first started, we had these proportions that we followed. Like, let's take for instance the lip. The upper lip is 1/3, the lower lip, the ratio 2/3, but it's not the case for everybody. For Indian patients, sometimes a 1:1 is normal. For an African patient, sometimes the top lip is bigger, which is normal. And sometimes for the same for patients that are Middle Eastern, for Asian patients, depending on your skeletal tissue, it's really, really so diverse. And having a basic template for beauty might be okay, but following it like a cookie cutter is certainly never been the thing to do. But now they're making it a trend to be individualized, when it should have been there all the, like, I don't know, I was just like, I can't believe there's a whole meeting about individualized beauty and the importance of it. And maybe we take it for granted because we see so many different kinds of people in the practice, and also because we are not in that original aesthetic demographic, because it was mainly older white women who would be doing these treatments when I started, and now the trend is changing. It's men, it's people of all ethnic groups, different ages. So you have to tailor your treatments according to the patient's lifestyle, their preference. Do they want to look softer? Do they want to look more angular? And within reason, of course. So yeah, that trend, I don't know. But anyway, it is a trend, and maybe it's a good thing that it's a trend, so people can focus on not alienizing people, or kind of taking them out of what they should look like. Rounder face. Indian people shouldn't have that North European, if they don't have that natural face structure, as a generalization though. Injecting a bolus here, having these two little maleficent knobs sticking out, it might not look great on everybody. And I'm glad maybe there's a move towards that sort of thing. Sometimes the trend also diminishes the seriousness of the treatment, because all these treatments, remember, they're medical devices and they are drugs. So when you think of, say, the salmon sperm facial, it sounds so out there and ridiculous, but it's basically really, really super purified nucleotides from like an untouched cell, which is a sperm cell. And then it's used for wound healing, for infraorbital rejuvenation, lots of like different things, and is there enough evidence that it works, or is it just a trend? So yeah, it's a lot to unpack, but that is my rant on trends. So in aesthetics, it's nice to have trends. It gives a bit of interest and discussion on treatments out there. It makes the general public aware of what's out there, but don't follow trends. Like, don't think you have to do everything that's suddenly trendy, and it might not be the most suitable treatment for you. Most important, have a consultation, discuss your needs, consent to the process, and if you're suitable and it's safe, it's great to do so. If you have any questions about trends, or if there's a weird trend you may have heard of, I'd love to hear about it. Drop it into the comments, DM me on Instagram. You can even WhatsApp our practice. And like, share, and subscribe. Bye.